It's excellent news that we've been able to secure additional vaccines to be sent to us. Today is the last day of vaccination, so we will have used up all our vaccines by today. So it's perfect that we are receiving an extra batch of Pfizer vaccines tomorrow and then an additional one later on. That means that we can now call on and invite other members of the public to come and have their vaccines, and we can also guarantee that the first cohort of people who had their vaccines at the beginning of the week will be guaranteed their second dose within 21 days.
And the good news is that you'll be able to extract more doses from these vials.
Yes, it is also the practice in the UK that you are able to extract 6 doses of the vaccine from each vial. Initially, we thought that we would be able to have 5, but it has become common practice that we can extract 6. And on that basis, we've been able to have more vaccines or be able to deliver more vaccines than we originally anticipated. So that is also excellent news.
So who will form part of this next cohort to receive these vaccines?
Well, the first cohort, as you know, have been invitations to everyone over the age of 70 and also to people who have been extremely clinically vulnerable to this disease. So we have gone through those lists, and you may recall that we have invited anyone within that cohort who may not yet have received a call to call us to arrange an appointment. And now we're moving on and offering the vaccine to people who are over the age of 65. There's no point in keeping the new delivery of vaccines in the freezer for a further 2 weeks to wait for the second dose for the first people, because having vaccines in the freezer doesn't let us progress. So we are moving on swiftly on to the next batch to make sure that we are running all these processes in parallel.
And when the next vaccines are received, those will form part of the second dose for the first cohort, right?
That's the timing that we will use, and that way we can guarantee that we can give the second dose to people who've had their first dose this week.
Can you just confirm who are frontline staff, please?
We have 2 vaccination centres running in parallel. So we've got the public vaccination centre at the old PCC, at the ICC, so that's for members of the public, people who are called up. But then at St Bernard's Hospital, we have the GHA vaccination centre. We have now vaccinated the majority of frontline workers within the GHA, and we've also started offering the vaccine to other frontline workers and other essential services workers who keep Gibraltar going, so we need to make sure that they're safe as well.
Can you just give us an idea of who those essential workers are?
We've started already with members of the Royal Gibraltar Police, with officers from Her Majesty's Prison, with officers from the Gibraltar Fire and Rescue Service, and we're looking at those kinds of essential services. If you recall, at the beginning, we had screening processes, or we had one regime for clinical frontline staff who were swabbed on a very regular basis. And then we also offered screening swabbing to other essential services. So it's these essential services who we consider frontline, having vaccinated all the clinical staff at the GHA. We'll start with teachers at the weekend, and as you know, as was announced by the Chief Minister, within the cohort of teachers, we'll be starting with teachers who teach at St Martin's School.
So can you just clarify, if someone has recently had COVID-19, will they then move down the list for those next in line to receive the vaccine?
If people have had COVID recently, they will not be offered the vaccine until 28 days since they were positive with COVID. But they are we're still going through the cohort. So if anyone is within the cohort of being over the age of 65 now, or being in a clinically vulnerable group, or being a frontline worker, then they need to be offered the vaccine within 28 days of being positive of COVID.
And just by way of clarification, I know the Chief Minister dealt with this issue yesterday, but if you are asymptomatic and positive and receive the vaccine, there's no harm to you?
I'm advised by the doctors that there won't be any effect. It's the probability of that happening is quite low, because before having the vaccine, you're taken through a questionnaire. So questionnaire will ask you all sorts of details. So it may be that it gets picked up there. But because we have such a high screening process in Gibraltar, so many people are screened and are swabbed before that it's very unlikely that we will be vaccinating people who are positive. But having said that, if you're positive and you receive the vaccine, it's very unlikely that you may have any adverse effects, and I'm advised that you also get immunity in the same way.
One final question on the vaccines. When would you expect the programme of vaccination to be complete? When will everyone in Gibraltar who wants the vaccine receive it?
It all depends on how the further supplies of vaccination is provided to us. If they continue to be provided to us on this regular basis, then we're looking at being able to vaccinate the whole of the population in a matter of months. If you look at the setup that we have, it's an extremely effective vaccination centre. They vaccinate over 500 people a day. They have reserve lists in case people don't attend their allocated appointments for whatever reason. And we have ensured so far that not a single dose of the Pfizer vaccine has been wasted. This is so precious for us that we have all sorts of contingency plans in place so that nothing is wasted.
Minister, we're all aware of what a harrowing time it's been for the community, with so many COVID deaths and high numbers of people admitted into the COVID ward and CCU. Can you just give us some insight into how staff are coping under such difficult circumstances?
This is an extremely difficult time for staff. We have a lot of patients in the Victoria COVID ward. We have a lot of patients in the CCU, patients who are ventilated. People who work in the hospital, clinical staff, work 12-hour shifts. People who are working in the CCU are not only working in demanding conditions because they have a full ward of patients who are ventilated, and it's complicated treatment, but remember that they also have to undertake this task in full PPE. This is not an easy task. It's demanding, both physically, and it's also very draining psychologically and draining mentally. And if we think about the pressures that have also been applied throughout our ERS sites, this is also very difficult. Just imagine yourself as someone who works in Montalvernia, and you're working on your particular floor, and you've had this relationship with residents for a long time, and now unfortunately residents at Montalvernia have passed away. Our staff have a relationship with those residents, and they also feel, in addition to their exhaustion from the amount of work that they have to put in, then they're also saddened by the loss of the residents, because these residents over the years become their friends. We have deployed therapeutic support to all our staff. The care agency counselling and therapeutic team is providing frontline resilience therapeutic support to staff at the care agency and also to staff at ERS, because we recognise that everyone at ERS, in addition to being exhausted from their hard work, are also emotionally exhausted, and we want to make sure that we're there to support them as well. Therapeutic support is also being offered to the hospital by the government's therapeutic team as well. So we're looking after our staff welfare as well.
Well, the community is planning a clap at 8 o'clock tonight. I imagine that'll be a much welcome morale booster for the staff.
I'm sure it will be. I only wish people could understand the tremendous amount of work that's put in by all the frontline clinical staff with their full wards, having to work long hours, having to work with PPE, and having to deal with the emotional effects of what they're seeing, what they're experiencing, and everything that they're having to do. I cannot thank the staff at the GHA, at ERS, or the care agency enough for all the work that they're putting in to make sure that they safeguard everyone in our community.